Kenya is on a mission to improve its healthcare system and make universal health coverage a reality. At the forefront of this effort is the Global Health Workforce Program. Universal health coverage means ensuring everyone gets the care they need without financial strain.
There is evidence that when you're using primary health care, actually the return on the investment are 1 to 16. And also the efficiency and effectiveness in terms of improving the indicators, it has been shown as one of the best approaches globally, regionally, and even here, that we can get to UHC in a better way, a faster way when you're using primary health care. So the government actually has put a lot of focus on it currently. It has given it the urgency and the importance that it deserves in terms of policy, in terms of implementation, and also in terms of intervention in primary health care.
Kenya faces a unique challenge, battling infectious diseases like malaria and HIV, while also dealing with the growing threat of lifestyle diseases like diabetes and cancer. To address this, the government is prioritizing primary health care through a system called Primary Care Networks, PCNs. To achieve this, Kenya is aligning with the Sustainable Development Goal on universal health coverage. The government has introduced strategies like the Kenya Primary Healthcare Strategic Framework 2019-2024 and the Primary Healthcare Act 2023.
The government actually came up with the 4 major acts, including the Primary Healthcare Act, the Digital Health Act, the Facility Improvement Financing Act, and the Social Health Insurance Act. Since then, 2023, when these acts were passed by the government, primary health care actually has been fast-tracked. There's been a lot of RRI, including training of national TOTs to implement the primary health care networks that had informed, and we trained 248 national trainers. We have established now 216 primary health care networks out of the 315 that we are targeting currently.
Tropical Health Education Trust, now a Global Health Partnership, undertook an assessment talking to the ministry, Council of Governors, the county governments, academia, and also implementing partners. What was really identified for Kenya was that, yes, there was need to address shortages of health workforce, but especially in response to primary health care and universal health coverage. So this were critical as the Global Health Partnership projects were being implemented in Kenya because they needed to be responsive to these aspects.
These initiatives aim to strengthen primary care and provide essential health services, especially in underserved areas. This progress is supported by the UK government through the Department of Health and Social Care, with funding managed by the Global Health Partnership, formerly Tropical Health and Education Trust, and implemented by IntraHealth International, Primary Care International, and Strathmore University Business School in collaboration with the Ministry of Health and the Council of Governors. Together, they're empowering healthcare leaders in 10 counties: Kisumu, Garissa, Kericho, Nandi, Kirinyaga, Kitui, Tana River, Meru, Bungoma, and Mombasa.
For us as IntraHealth, when we saw the call in November 2023, we did respond to it. We brought together a health partnership or a consortium that comprised of IntraHealth, Strathmore University Business School, and also Primary Care International, who are our UK partner, and that would facilitate the north to south learning. The purpose of this large grant 46 was to look at aspects of leadership, management, and governance for primary healthcare. We aspired to ensure that county health managers, facility in charges, were capacity built with the requisite skills for them to effectively implement the primary care networks. And this is a model where there is a hub and spokes, and it is in responsive to primary healthcare at the grassroots level.
Strathmore Business School's Institute of Healthcare Management, led by Professor Gilbert Kokwaro, plays a vital role by training healthcare managers to lead effective and improve services in their communities.
The Global Health workforce strengthening program is actually part of the activities that we undertake at Strathmore University of training various cadres of healthcare workers and policymakers on good principles of leadership, governance and management.
We were able to design the leadership management course. This was building on prior work that had been done here in Kenya by IntraHealth and Strathmore Business School. This allowed us to adapt and strengthen that existing curricula to integrate it with primary healthcare and also gender equity and social inclusion.
Our work with IntraHealth in the area of LMG, targeting healthcare workers, started way back in 2016. It's almost going to, in the next year, it will be a partnership that has lasted for almost 10 years. So this is what, again, is important, is that you create partnership, not to respond to a particular call, but you create partnership that are actually bound by a particular theme or by a particular goal in, for us, enhancing LMG capacities within the health sector.
Through a blended training approach, 63 healthcare managers across these counties have gained critical skills in leadership, management and governance to enhance primary healthcare services.
The 10 counties that we targeted, this one gave us an opportunity to actually pilot some of our concepts and ideas and also to get feedback from the participant body. I think the feedback was excellent, it's positive, it is timely in the sense that this is when some or most of the countries are either putting in place, trying to establish the PCG or operationalizing. And moving forward, we think that it should be cascaded. Obviously, it would be a shame if it was left to the 10. It should be cascaded to cover the entire country. But more importantly, what I say is that it should not be an event. This should probably become an annual event. Aspect of this should annually be done. Because, let me tell you, new workers will come there. People will keep on moving. New facilities will come up. So it needs then to be institutional. So it becomes an annual by annual event.
The training met my expectation 100%. And I want to pinpoint on the issue of GESI, that we need actually to give each and every gender, every social group a chance to give their best in performance.
Introduction of gender equity and social inclusion for us also meant that we look at our trainee selection. We aspire to have 50% of our trainees being women, and we were able to achieve that. I think we got the 30 that were required, and these women were facility in charges, leading level 2 or level 3 facilities. Some of them had never been trained on leadership management and governance, so this was really for them an opportune time.
Through this course, actually I've learned several things that I didn't know before. Yeah, despite the fact after going to college, but there's some new things that I've gained from this training, and they've really impacted me at my place of work in several ways.
To me, I am a mentor to some young ladies, and so it has made them realize that it is possible. As a lady, you can make it, you can rise. All that networking that has happened, I was in a position to realize that sometimes you do not have to wait until you have enough to start something. You can make use of what you have at your disposal and make a change.
Success was ensuring that we were able to have in place health managers that had a systems thinking when implementing primary health care. And I think we were able to achieve that from the 63 trainees and the type of leadership challenge models that they were able to undertake. In addition to that, we were also looking at success in terms of ensuring operationalization and functionality of primary care networks. Within the 12 months of the project, we were able to achieve 14 primary care networks being implemented. So as we look into the future with additional funding and resources, we would assist the government, both Ministry of Health and the Council of Governors, achieve the 315 and also catalyze discussions around collaboration. The establishment of a primary care network is costly, and it requires various implementing partners coming together. Success to us is also that services and their design are owned even by facility in charges who are the spoke, supported by the hub, so that that community the rendering of community services as well as preventive and promotive care is actually reaching Wanjiko or any within the shortest distance from their household. That to me is our aspiration as we looked at this project.
The success of this program demonstrates what's possible. To ensure quality healthcare reaches every Kenyan, we must continue strengthening leadership, improving management, and making sure no county is left behind.